Hi, my name is Dr. Sasha Thomason, and I have the pleasure of serving as the Animal Facilities Inspection Program Director here at the Kansas Department of Agriculture. We want to welcome you to the second AFI webinar of the summer. I appreciate you all taking time today for this webinar, which is focused on controlling common dog diseases, especially focus on cleaning and sanitation. For the next 60 minutes, we will be focusing on controlling common dog diseases in animal facilities. And this is important to KDA licensees to improve the health of their animals and in their care and reduce the spread of disease. And so a few housekeeping items before we begin. During the presentation portion of this session, all participant microphones will be muted. If you have a question during the presentation, please submit it using the chat button at the bottom of your screen. And we will be monitoring that to ask those questions at the conclusion of the presentation. And then this session is being recorded and will be posted online next week. So I would like to introduce Dr. Ron Orchard. He has a doctorate in veterinary medicine and a master's degree in public health. He is currently a fellow with the Kansas State University's Shelter Medicine and Community Outreach Program. He's worked extensively as a veterinary technician and hospital manager with some of the largest animal welfare organizations in the Western United States before he entered vet school. He is a certified animal welfare administrator, has received a certificate in organizing social change from the Midwest Academy, and completed the certificate for diversity and inclusion in veterinary medicine from the Purdue University's College of Veterinary Medicine. Whether he's mentoring students or advocating for homeless pets, he has volunteered countless hours supporting efforts to provide free preventive veterinary care to vulnerable community members and at-risk animals. And so now I'll turn it over to Dr. Orchard for the presentation. Thanks.
Thank you, Dr. Thomason. I'm going to go ahead and start sharing my screen. Okay, hello everyone. I created today a presentation that's essentially there's two parts to this presentation. The first one is going to be going through our common canine diseases that we will see in these animal facilities. For my purview, that's predominantly animal shelters, so I'll use the term shelter quite a bit throughout this presentation, but animal facility would be a synonym for this as well. And then the second half of this presentation, we'll get into some of the specifics about controlling these diseases through sanitation practices. I wanted to introduce myself a little bit more, even though Dr. Thomason gave me a really great introduction, which I appreciate. But currently I'm a fellow with the K-State Shelter Medicine and Community Outreach Program, completed a master's in public health in 21, have been a certified animal welfare administrator since 2016. And all this is to say that I've had the privilege to be a part of veterinary medicine for the past 16 years, even though I've only been a veterinarian since May. So I have a lot of extensive experience with the pathogens we'll be talking about today, as well as the sanitation practices. And I'm currently going to be starting a PhD program here at K-State in August. So I'm excited to stay around Manhattan and hoping to be here for a few more years. So I started this presentation with diseases, focusing on what diseases we would commonly see in our animal facilities or animal shelters. And I thought maybe I should speak on why I wanted to start with this focus rather than going straight to the sanitation practices and whatnot. And so I have an image here. I don't know if everyone has been as obsessed with the Marvel Cinematic Universe as I have been, but I've watched every single show and movie there is that's possible. And so we have our big baddie, the big villain, Thanos in the background, and all of our Avengers who are assembling to take this enemy down. And so realistically, this is just a great analogy for us to see. We have to understand our enemy and how they function in order to destroy them, in order to vanquish them. So here's an image. I did my poorly photoshopped image here, but we've got an image of a virus in place of Thanos, and some of our products which may be more effective than others at actually battling this particular villain. So a little bit of the lens of shelter medicine, or really we can think about it, medicine within our animal facilities. So where we have to focus on more than just a single pet. I find this is a nice starting point when we're thinking about the differences in how we diagnose and handle and treat the diseases we see commonly in these facilities. Private practice is what most of the world is going to be more familiar with. And so there are some similarities though. So both private practice and shelter medicine, we emphasize prevention. And we'll talk a little bit more about that, but that can be through vaccinations, as well as, through some of our biosecurity and sanitation practices. Diagnosis is obviously a challenge in both of these venues. Within shelter medicine and animal facilities, it's a bit more of a challenge because we lack history on our patients, which we will have quite extensive history from private practice, and typically some charting. I know that's what we have at KSU, really extensive charts on these animals. Whereas in our animal facilities and animal shelters, we lack that often. So that's a challenge for us. Treatment is another difference. We're both focused on efficacy, costs, and ease of administration. But our animal facilities often are either nonprofits or public entities who really do have some significant challenges as far as cost and ease of administration of medication is concerned. Now, looking at our facilities and our shelters, there are a couple of other considerations to make when we think about these diseases. Our risk to our population that we have on hand is primary. We're not just thinking about an individual pet in a home, we're thinking about all of our animals within our facility. So comparable to a herd health type of situation. This gives us another wrinkle to think about, which is how treating and diagnosing these diseases in our organizations has an effect on how long those animals will stay in our care, which directly impacts how many animals we have on hand at a single time. And the final consideration for our organizations is the public health risk of the diseases that we see. Our goal for our animal shelters and many of these animal facilities is that these animals eventually are released into the public. So we must make sure that they are not carriers of diseases that can be zoonotic to people. The diseases that I'm about to go into detail on, there are two key factors which makes them all members on this list. The first one is that they're all highly infectious, and that's why they are so prevalent within our facilities and shelters. And the second, which is a nice counterpoint to that, though, is that they're all preventable, either through vaccinations and appropriate biosecurity measures. But these are the attributes which they all share. So back to the MCU. I'm sorry, I'm obsessed. We have Thanos here who believes he is immortal. And parvovirus is the best place to start because of all of the pathogens we're going to talk about today. This is our Thanos. This is our enemy that we have to be very thoughtful about how we destroy them. So I'll tell you a little bit about canine parvovirus. So it's transmitted primarily through contaminated feces and fomites. So inanimate objects like doors, floors, gates, bedding, things like that. Now, what makes it our Thanos is that it's extremely resistant to our common means of sanitation because it's a non-enveloped virus. So this makes it a very hardy pathogen. It can live in the environment for up to months if we do not go through appropriate sanitation measures. Our diagnosis is typically going to be based on clinical signs, which include anorexia, vomiting, diarrhea, which can be with or without blood. I know traditionally we always associate bloody diarrhea with parvo, but that's not necessarily always the case. And due to the severity of these outbreaks, our ELISA testing should always be used in any suspected outbreaks and suspicious cases. So these would be our younger puppies, our naive animals, and any of those that are fitting this clinical picture that we see here. Treatment is a pretty exciting development for us within the shelter medicine realm and animal facilities, and that there's actually now been some research outpatient parvovirus protocols, which have comparable efficacy, so comparable survival rates compared to what we would traditionally think of as a gold standard treatment. It's nice to be able to provide this as an option. One, we're getting parvovirus out of our facility, which then decreases the risk to all of our other animals within our facility. And two, traditionally for our animal shelters type organizations, a disease like parvovirus would be one that would often be so expensive to treat, it would cause owners to relinquish their animals, thereby eliminating that human-animal bond and then giving us animal shelters a very ill animal that requires many resources and is the risk to all of our other animals on hand. So there are some exciting developments as far as treatment is concerned. Prevention, as we discussed, this is a preventable disease. Vaccine, we have an excellent vaccine. This is a component of our core canine vaccine. This is why we recommend for any of these facilities to vaccinate on intake, and it's very preventable by utilizing that vaccine. Now, disinfection, how are we going to take Thanos down? And we'll get into some of the details on this specifically later, but I wanted to emphasize this with this particular disease, the specifics on disinfection. The two disinfectants, which I think about, which is kind of the two ends of our spectrum as far as cost and ease of use for parvovirus would be our accelerated hydrogen peroxide products. So an example would be Rescue. This is, however, expensive, but it's an excellent product, and we'll talk about it in detail later. We also have the other end of the spectrum, which is bleach at a 1:32 dilution. This is also very effective at controlling this particular pathogen. The thing that's nice about it is that it's very cheap. So there's no excuses for a parvo outbreak. We can control this. The other kind of confounding issue here is that there's a commonly known product called Parvosol, which is a quaternary ammonia, and it actually is not effective at killing parvovirus, which has been researched. So that's a bit frustrating and confusing. So make sure to clarify that for everyone. Moving on, we have kennel cough. And so kennel cough is really just a syndrome caused by any number of pathogens. So we commonly as veterinarians refer to it as canine infectious respiratory disease complex, or CIRD. Again, a variety of agents, all viral, bacterial, and some of them are even normal flora of the respiratory tract that are opportunistic organisms. And so many of these pathogens, and I'll go into detail on most of them, have prevention measures like vaccines, and some of them are normal flora like a mycoplasma, and some of them are a bit rarer like our strep zoo. Mode of transmission for this disease is going to be aerosol droplets. It is highly infectious. Again, that's why it's on this list and being talked about today. Our diagnosis, I'm sure by now we've all heard a kennel cough dog coughing. It's that duck honking cough, but it could also present with some clear or mucoid nasal and ocular discharge. And in some cases, it can actually progress to pneumonia. Our primary means of treatment are going to be decreasing stress and supportive care, and in some cases antibiotics if they're indicated, depending on what pathogens we believe are at play here. And really also huge is going to be effective isolation to prevent the spread. Prevention is going to be vaccinating on intake for those particular pathogens, which there is a vaccine for, and I'll talk about that in a bit. And disinfection, you'll see this on the rest of these slides. Any of the below products that I'll mention later on will be effective against these agents, and I'll talk about them in specific detail in the second half of this presentation. Canine distemper virus is also spread by aerosol droplets. It is also highly infectious. This can be transmitted by direct contact and, to a limited degree, fomite transmission. Distemper virus is difficult to detect, which makes it a really challenging virus for us to diagnose. A PCR is what we would use to confirm this diagnosis, but what makes it difficult is that there's such a wide range of clinical signs. So It can cause respiratory signs very similar to kennel cough, but it can also cause GI signs, so like diarrhea, but it can also cause neurologic signs, so things like seizures. So three very different types of presentations of this disease. So that's what makes it a challenge for us to diagnose. The treatment is going to be to isolate immediately and then provide supportive care based on the clinical signs that the animal is actually presenting with. Euthanasia may be indicated in some severe cases, or if that facility is unable to locate. Even here within the state of Kansas, while I've been here and a part of our shelter medicine program, we have had facilities have to depopulate due to this disease because it is so severe and so infectious. But the good news is that there is a very effective prevention measure, which is a vaccine. Again, this is a component of our core vaccine that we recommend all animals get on intake. And it's also able to be disinfected very easily with the products that we'll talk about later. Adenovirus, so this is one of our components of our SERD complex, aerosol droplets. Clinical signs, if there are any, are consistent with our kennel cough that we described earlier, so that honking cough, but it could also progress to an interstitial pneumonia. We diagnose that with a PCR, and our treatment is going to be supportive care and adequate isolation. We have a vaccine on intake, and just kind of a fun FYI, this is adenovirus 2. There is also an adenovirus 1. We're able to cross protect with just that single vaccine with adenovirus 2, which is a component of that core vaccine for both of those types of this adenovirus. And disinfectant is going to be any of the products that I'll talk about later. Canine influenza, not to be confused with parainfluenza, is spread via aerosol droplets as well as direct contact and fomites. We have numerous strains that have been tied to specific outbreaks that we've seen in recent history. The diagnosis can also be a challenge because we may see no clinical signs, but the animal is still very infectious, so shedding virus, but it can also cause very severe clinical signs, which could be a purulent or kind of, we think of a mucoid upper respiratory discharge, but it could also be a hemorrhagic pneumonia, so bloody nasal discharge even. And we confirm that with a PCR and a serology. Supportive care and isolation are going to be huge for this particular disease, and prevention for this is going to be a vaccine on intake, but this is getting out of the realm of our core recommended vaccines. This is one that's going to be really based on the area that you're in, and luckily at this point in time, we do not have an issue with it in Kansas, so it would not be a component of our recommended core vaccines, but there is a vaccine that exists. And disinfection is going to be by any of the products that we'll talk about later. Rabies is a virus with significant public health consequences, and so we absolutely have to talk about it here. Its mode of transmission is going to be infected saliva. Again, it has some various clinical signs. So we have our dumb forms and our furious forms. So the furious form is kind of what you think about like a Cujo dog or something like that. The way that we diagnose this, so we suspect our diagnosis based on the clinical presentation and history of these animals. But the only way we're going to be able to confirm a diagnosis is going to be via post-mortem direct fluorescent antibody test. That's going to actually be performed on nervous tissue. So if you ever seen that we've needed to actually receive a brain or brainstem in order for that test to occur, that's the only way for us to confirm that diagnosis. There is currently no treatment, so we really have to focus on prevention for this particular disease. However, like influenza, this is not considered a core vaccine for our animal shelters and facilities. The reason that we designate this particular disease this way is that if we are disinfecting and sanitizing our facilities appropriately, and if we are managing our animals appropriately, they should have no risk of contracting this disease while they are in our facilities. So they should not be mixing with other animals, having the ability to ingest that saliva and they should also have clean kennels and housing to really prevent the possibility at all for them to acquire an infection with this. But a vaccine is available. It should be performed at a time of spay and neuter or adoption. And disinfection is going to be from any of the below products that I'll discuss in just a minute. So these were the biggest diseases that we think about in our animal facilities, animal shelters for dogs that have been the biggest challenges for us when we think about diagnosis, treatment, and prevention. And these are really what we should use to guide our sanitation practices. So to go over our takeaway points, we really want to emphasize prevention of these diseases, emphasizing prevention with vaccination on intake. That's really going to be our highest level of protection for population in our shelters and facilities. And it's going to bring us the best outcome. So we won't be challenged with ill animals and an increase in length of stay, which is also a big challenge for us. Another big takeaway point is that many of these diseases that we talked about require isolation, and that isolation should get them away from the general population. And in some of these cases should also allow us the opportunity to have ideally some type of separate airflow or ventilation. So it's, yeah, and it's important. It is an important factor in all shelter resources to determine if this disease is actually treatable. So basically this just means some of these diseases are so contagious and so severe that if we don't have proper isolation, a decision based on the animal's disposition should happen sooner within the process. So if we don't have a way to properly isolate distemper or parvovirus, it may be the best in the best interest of our entire animal population to euthanize a particular animal. Is essentially what I'm getting at that last point. And of course, our importance on length of stay. The best solution when we're having a kennel or shelter type situation is getting them out of that situation as soon as possible. The more days they're actually in this facility, they are more likely to contract a disease and then thereby lengthening how long they're in that facility. So these are the takeaway points from all these diseases in general. We want to prevent them. We want to isolate them once we believe they have one of these diseases, and always having a focus on length of stay and shortening that whenever possible. So that is the first half of this presentation. I have my email up there. I'd love to take questions offline, but also if there are any specifically about any of the diseases that I discussed already, now could be a good time to do that. I can also have some time at the end if that makes sense.
One question is about battling Giardia more than anything. How do you fight this the best in the kennel? I don't know if you want to answer that later. Or... Yeah,
we can answer that later, since that's a separate pathogen. It's actually a parasite, a prozoan. So the way that we would battle that would be a little bit different. And so, yeah, feel free to email me and we can take that offline, since it's not one of our common ones that we think about in this way. Yeah, I'd love to engage you on that. Excellent. Okay, now we're going to get into sanitation basics. So we're utilizing our knowledge of the pathogens that we just learned about, and now we're going to really figure out how we're going to appropriately control them with sanitation. Our specialty, we're fortunate enough that our specialty has these guidelines that offer us best practices. So this is a great resource for any of our shelter veterinarians, but also any shelter managers, facility managers, anyone who is housing, group housing multiple animals at a single brick and mortar facility at a time. This is a great resource for you. So I encourage all of y'all to Google this document and read through it. We use this as a text for our students when they're going through our course, and we refer to it often whenever we're making recommendations on best practices and protocols. So of course, they will address something as crucial as sanitation. So the quote from the guidelines regarding sanitation: good sanitation is an integral part of humane animal housing. Proper cleaning and disinfection practices help reduce the transmission of infectious diseases to both animals and people and result in a cleaner and healthier environment. So really hammering home why this is such an important topic. So I want to make sure that we are all on the same page with our terminology, so that we're all communicating and understanding what we're saying when we're talking about sanitation. So to first start off with the term cleaning, this really just means the manual removal of dirt and organic debris. So we can think about, if we're thinking about cleaning our kennels, this is the first step in our cleaning our kennels, right? This is when we're scooping poop that's in there. Maybe we're sweeping up some kibble that got knocked on the floor. Maybe we're removing some soiled laundry, but it's really, that's what when we use the term cleaning, that is technically what we mean as cleaning. Now, disinfecting would be a specific process, and that's when we're using either physical or chemical means to kill or destroy pathogens that would still be present after cleaning. So this would be any of the disinfectant products that we'll talk about in detail in a minute. But in some cases, this could also be physical means, like some facilities will actually use warmed up or kind of like a steam cleaner when they're cleaning their kennels. So that'd be an example of a physical means to disinfect. But that's specifically what we're talking about. We're talking about killing or destroying those pathogens. Now, I'll put these last two up at the same time because they're important to distinguish from each other. So we have sanitizing and sterilizing, and sometimes they get confused for each other. So sanitizing is when we try to eliminate as many infectious organisms through cleaning and disinfecting. But a lot of times I hear these words used interchangeably from some of our shelter partners across the state, where they'll say, yes, I just sterilized that kennel. And sterilizing would be only when we remove all microorganisms from an inanimate surface. So that would require something very specific, like an autoclave. And typically those are via pressure and steam, and in some cases, actual chemical means. So two very different things. Sanitation would be, we are eliminating as many as possible. So that's typically our end goal when we're talking about our kennels. Sterilizing would be something that we would think about like for our surgical instruments or things like that. So our goals for sanitation, first and foremost, as we discussed, we have a population of animals on hand. And if we are the operator of this facility, the manager of this facility, our first responsibility is protecting all of our animals from disease. So this is the main goal for sanitation. We need to keep this in our focus. We also have to protect our staff, volunteer, and visitors. We discussed there are some public health diseases of concern. So we need to make sure that our animals are staying healthy and our facility is staying clean in order to protect them. And lastly, we want to create a pleasant and welcoming environment. Some of this may sound nice and fluffy language, but at the end of the day, for our organizations whose goals it is to move these animals on, creating a welcoming environment is going to help decrease our length of stay. If we are a facility that the public wants to enter, this will only benefit our animals and our organization. So this is why it's such an important goal and why we discuss it here. We want to be a resource for our communities, and that's by keeping a clean, pleasant, and welcoming environment. Why shelters are high risk. And we discussed some of this before, but we have a vulnerable population. First and foremost, we often have no or very limited history on these animals, including vaccine history. Many of these animals have never seen a veterinarian before, so many of them have never been vaccinated before. We also have a continuous turnover when we're looking at these organizations. So we're getting in numerous animals a day. Some of them are leaving, some of them are coming back. So this is also, again, a nice recipe to brew infectious diseases. We have overcrowding, and due to this overcrowding, proximity to animals that is less than ideal when we're trying to control for infectious diseases. This leads to stress within our animals, and we know that stress compromises their immune systems, again, making them more vulnerable to infections. And as we went through just a brief list, as someone already asked about Giardia, that was only a list of some of the most contagious and infectious diseases in animal shelters, but there are others. And some of these are very durable pathogens, which are really difficult for us to control for. So this also makes our populations very high risk. And as discussed previously, many of our organizations have resource limitations, whether that be money, whether that be staff, and in some cases facility. We emphasized, we really hammered the point home about isolation. But if some of these organizations, facilities do not have the ability to isolate, that really makes their populations at a high risk, especially if they are stuck with legally mandated stray holds and would prefer to come to a disposition on an animal sooner, but are stuck due to stray hold. That can also be a limitation for them if they have no isolation space. This is a fun graphic I like to include. When we go through vet school and we learn about disease transmission, we're given a really boring triangle. In each corner of the triangle, it's like your host and your pathogen and your environment, and it's really a helpful learning tool, but it's not as goofy looking as this dog is here. So we can see everything that's coming out of this dog is of concern to us. There are so many different types of diseases that are going on with this dog. So it's a helpful graphic, not so much in that I would expect anyone to memorize every excretion from this dog and what diseases are coming along with it, although that would be nice. But it's really to tell us that everything and anything with this dog could potentially cause some type of disease and be contagious to some of our other animals in our facility. So this is why we really must focus on sanitation, because look, it is literally from snout to the tip of the tail. There are things that this dog could carry and pass on to some of our other animals within our facilities. So when we're developing a sanitation protocol, we want to make sure that we're being very thoughtful about this. So this obviously starts with the right product. When we think about the right product, we have to think about what pathogens we're really focused on. We have to think about the environment. So what is our kennel situation actually looking like? And then we have to think about our staff, our people power resource. How long are we asking them to spend on each kennel, and is it actually doable? Is it possible? We have to have the right process. So that means understanding our products. So what is the appropriate dilution for them to kill the pathogens we want them to kill? Our contact time. How long do we have to leave these products on the kennel floors that we're trying to sanitize in order to adequately kill the pathogens we're trying to? So our contact time is important. We also want to make sure that we're sanitizing the right places. So which people, equipment, services, animals, anything that we need to make sure is sanitized is actually getting sanitized. The way that we control for this is that we have a standard procedure which will address all of this and have a specific written protocol. We also recommend that this is reviewed regularly and evaluated for efficacy. It's a nice time whenever we have an outbreak within one of our facilities to review our sanitation SOPs and make sure, are we doing everything that we need to do? And perhaps even looking at it, what diseases do we think were implicated in this particular outbreak? And perhaps there's something we need to tweak within our sanitation protocols that has brought this outbreak upon us. The ideal disinfectant. We want something that's broad antimicrobial spectrum of action, but also would be effective in the presence of organic materials. So thinking about maybe there's a little bit of poop in the kennel or something still, it would still be effective against that. It would be nice if this product could also be used in a variety of environmental conditions. So various temperatures, pHs, as well as porous surfaces, if it would still be effective in those kind of little surfaces. It would be nice to be compatible with other chemicals. You'll see when we go through these products, many of them do not include a detergent component. So we would need a product to clean in order to eventually disinfect with this product. So it'd be nice to be able to combine it and have them both at one time. We want something that's non-toxic, non-irritating, non-corrosive, non-staining. We want all that, and we want it cheap. So all this is to say, this ideal disinfectant does not exist, but this is our wish list. We can dream. So here is that list of disinfectants I had mentioned before. I'm going to pick out some of these and go into detail on them, but this is kind of our common list of veterinary disinfectants. And so we'll get into detail on them. Bleach. I like to start with this one because, as I mentioned in our Parvo section, this is really the no excuses, rubber meets the road type of disinfectant. It's super cheap and it's very effective against some of our most hard to kill pathogens. So it's very effective against Parvo. It's very effective against ringworm. We just have to know our dilutions for that. So for any of our non-envelope viruses, that's a 1 to 32 dilution. And for our ringworm, so if we believe we have a ringworm type situation, it'd be a 1 to 10 dilution. It's nice because the product itself is stable for 30 days and then also stable for 24 hours once it's actually diluted to either of those dilutions. Now, as much as I'm a fan of bleach, we all know that there are probably some challenges with this particular product. So there is no detergent activity. So 2 steps are required. That's our cleaning and our disinfecting. So that's because this product is inactivated by organic material. So we have to make sure that that kennel or that surface is actually cleaned before we go to disinfect it with bleach. Otherwise, we're not doing any good to try to kill these pathogens. Bleach is also corrosive to metal, so that's a consideration for us if we're using this in our classic kind of kennel situation with the metal kennels. So this would add a 3rd step potentially for us. We'd have a cleaning step, a disinfecting step, and then a rinsing step. So something else for us to consider. Bleach is also an irritant at high concentrations. I don't know if anyone's had to ever fog their facilities with bleach. I sure have in my career. And yeah, I was feeling that. I was for a couple of days in my respiratory passages. So we've got to make sure that if we are using this and having our staff, that we're training them to dilute it appropriately and making sure that they are staying safe with this product. This product is also inactivated when it's exposed to light and heat. So that's why we have these opaque containers. And we also need to be very mindful about where we're storing them so that they're at a nice room temperature. Sodium dichloroisocyanurate, or Bruclean, and calcium hypochlorite, which is WYSIWASH. So these are 2 products I grouped together because they are very similar. As bleach was, these are also effective against non-envelope viruses. The product itself is relatively inexpensive. It is less corrosive and less caustic than bleach, or both of them are, and no rinsing is required. So we have some big upsides here. However, there are some catches, as we talked about. There are no ideal disinfectants. So our catches are there's no detergent activity. So we've got to have a cleaning. We've got to do something for cleaning, because it's inactivated by organic material. But the biggest holdup for me as someone who managed a shelter, a kennel situation, when considering this product, was that I needed specific hardware, specific equipment in order to use any of these products. We can see a couple of them here. We have just an adapter that goes onto a hose because it does a real-time dilution for us. Or you need specific dispensers in order to do this. So these can be big barriers to any of our facilities and also accompany a certain amount of cost. So a consideration, and which makes it not one of my preferred products, but it is a really great option should you be willing to make the investment as well as draft an appropriate protocol. Our quaternary ammoniums. These are some of our most traditional products we would think about in the veterinary disinfecting game. So we have Rocals, Parvosols, Kennelsols. Those, either that end with onium or start with quat. These are those type of products. These are inexpensive. They're an okay detergent, meaning they can work relatively effectively in the face of organic material. Effective to use, very stable, non-toxic and non-corrosive, but there's a big but. They're not effective against our non-envelope viruses, so Parvo and ringworm. This is extremely confusing because one of the products by name is called Parvosol, and it's been researched many times now, and it is not effective against parvovirus. So we do not recommend this as being one of our go-to disinfectants, and I think it has very limited use in any of our facility, group housing, or animal shelter situations. Potassium peroxymonosulfate, also known as trifectant or Virkon. So this is also effective against our non-envelope viruses, looking at Parvo. It does offer some detergent activity. So typically we're going to have to still have our two-step process going on here. This is generally effective in the face of organic material, non-toxic and non-corrosive. Again, we have some buts. This one is only stable for 7 days in solution, which is typically going to be adequate for our most of our facilities. It is also expensive, but again, bringing my experience into this, my biggest holdup with this particular product when I was deciding what to use in my shelter was the PPE required for this particular disinfectant. So as you can see here, some examples of it. It comes as a powder predominantly, and so we have to make sure that when our staff are diluting this or reconstituting it, that they have gloves, eye protection, as well as some type of mask or respirator, because this can be very caustic and cause health issues for our staff when they're reconstituting this medication. So this is a very important consideration when thinking about Virkon. So it makes it is an excellent option, but we must make sure we have that written protocol and that our staff are following it to keep them healthy and safe. Now we come to our favorite disinfection product. I can tell I'm in the right business because I'm brightening up just thinking about this product right now. It's accelerated hydrogen peroxide. Some of the product names are going to be Excel or Rescue. So this is really effective against our non-envelope viruses. Again, Parvo, talking about you. It has good detergent activity because it's effective in the face of organic material. Non-toxic, non-corrosive. It's easy to use, and it's stable 90 days after diluted. So that's going to be by far the longest you'll see of any of these products we discussed today. No rinse is needed on our kennels and surfaces. The only time we recommend a rinse would be in dishes, so something that an animal would eat off of. It's also effective against ringworm at a 1 to 16 dilution. So this is a really great product looking at all of those positive attributes. But again, as we discussed, there's no ideal disinfectant. So we've got some hangups here. This is relatively expensive. Of all the products here, this is the biggest barrier for this particular product, is that it is expensive. We do also need to use PPE when we're working with the concentrates, when we're making our dilutions. I feel like this is less of a challenge than it is with Virkon because our concentrates come in a liquid form, so it's not aerosolizing like the Virkon will when we're trying to dilute it or reconstitute it. So I think this is still an important consideration. I think Virkon is more of a challenge when looking at that specific point. But this is as close as we get to ideal. We really like this product and recommend it, but understand it is cost prohibitive in some cases. Now, a final slide to kind of wrap up some of the big questions about this. So combining products, again, we talked about this is important because we have we have a cleaning and disinfectant steps that need to occur. So in some cases, maybe we could save our protocol some time by being able to combine products. So looking at a bleach plus a detergent, that is okay. We can combine those. Looking at a bleach plus a quaternary ammonium, that is okay. We can combine those. Looking at a disinfectant plus hot water, that's better. We do like that quite a bit, although that can sometimes be a challenge to accomplish. We look at quaternary ammoniums plus a detergent. This is not recommended. We possibly inactivate whatever killing power there is in our quats. So we do not recommend it. Now coming to the last two combinations here, these are no-nos. So our bleach plus our potassium peroxymonosulfates or accelerated hydrogen peroxides. This is a no-no. You do not want to combine these products. We'll have noxious fumes and be inactivated. So you'll put yourself at risk, and you're not even doing anything if you combine those products. And then finally, bleach plus ammonia, that's deadly gas, like mustard gas. So not anything that we'd want. No benefit to us in cleaning if we create a deadly gas. So think about that when you're considering combining products. Contact time. This is really what we need to understand and appreciate for our disinfectants, because they take time in order to kill the pathogens that we're hoping to eliminate. So we have to understand the disinfectant types of the product we're using. We have to understand the concentration that we're using at which is a consideration for a product like Rescue. We can have a 1:16 dilution, and that contact time is only 5 minutes, but we could have a 1:32 dilution, and that contact time will actually increase by up to 10 minutes. So it's important understanding those concentrations and how those work. Temperature can also play a factor in contact time. The presence of organic material could possibly, as well as whatever pathogens we're particularly concerned about. In general, 10 minutes is most commonly recommended contact time. There is a link down here, a website that has a resource of some of these products and contact times, as well as I have a chart and other resource that I could send to anyone interested if you just reach out to me and contact me. So today we went over some of our common canine diseases in our animal facilities and shelters, and then we discussed a bit on how to control those, specifically thinking about sanitation practices. Hope y'all got a lot out of today's presentation. Obviously, we're still kind of scratching the surface on this, so I'm sure there may be questions, and there's likely diseases that were not covered here that I could definitely answer questions offline as well.
Thank you, Dr. Orchard. That's great information. We've been monitoring the chat, and we do have a few questions. The first one was, in a kennel operation, if there is a separate building available for isolation, can more than one disease be accommodated at the same time? And how likely is more than one disease at a time to occur?
Okay, great question. Yes, thank you. Yes, we can. So whether or not this is a separate building or even within the same building, we can effectively isolate for more than one pathogen at a time. Ideally, the way we would accomplish this would be by having separate rooms as well as separate ventilation systems. That's going to be our best practice on isolating for these different pathogens. But even just getting a separate rooms and keeping those mindful of our PPE and our staff who are going in there, that can also be an effective measure for this. And this is actually quite common within our realm of animal facilities and animal sheltering. I know the shelter that we visited yesterday with our students had multiple isolation units, and they were full with varying different diseases. So it is very common, but being mindful about these practices as well as decreasing stress within our shelters will help us control these diseases. The one thing to point out about this shelter is that these diseases were actually brought into that shelter. The animals were ill before they entered the shelter. So it's not that they were propagating disease there, which is a nice point to make, because their isolation facilities and disinfection practices are so effective.
Then where can small organizations purchase Excel or accelerated hydrogen peroxide? She's not been able to obtain it.
Okay, I would encourage that person to email me, and I can get them in touch with someone who can help them.
Okay. And then the next one, can you mix bleach with Pine Sol? The Pine Sol product helps in the summer keep flies out of my puppy areas.
Do not recommend mixing that bleach with the Pine Sol. There's a concern about inactivation with the active ingredients in the bleach. So it would still be okay to use. Either way, we should be going through a rinsing step with our bleach anyway. So at that point in time, a Pine Sol would be application would be okay.
And then, do foot baths work?
Foot baths do not work. This is an ineffective measure that has been touted for disease control. The issue with foot baths, as we've touched on numerous times in this presentation actually, is that in order for our disinfectants to be effective, we have to clear any organic material from them. And when we look in our foot baths, especially those that are stepped in regularly, they are full of debris, whether that be manure, mud, any of that, and all that is going to work to inactivate the disinfectants in our foot baths.
Can you discuss vaccination protocol?
That's a very detailed question. Again, that would be one I would, perhaps that could be a topic that we could go over in a subsequent presentation. But you're welcome to email me. There are a lot of great resources online as well. If you go to the site that I had up earlier, the sheltermedicine.com, they have vaccination protocols there, as well as feel free to contact me and we can come up with one that would work for your particular situation.
Okay. In similar vein, should we require Bordetella every 6 months? Most vets are requiring every year.
So Bordetella is not considered a core vaccine in private practice type of situation, and it's only required we only consider it core within our facilities for the reasons that we discussed, because we're having numerous animals at a time that are at a high risk for this disease. So in general, Bordetella does not need to be boosted every 6 months unless the lifestyle of that particular animal is putting it at risk for that particular infection. So is it going to be around a lot of other dogs and in a kennel situation? In those situations, then it would be indicated to administer that vaccine every 6 months.
And then the last one was the Giardia question. I don't know if you want to elaborate or just have this person reach out, but
yeah,
like she fights that more than anything. And
yeah, I mean that can be a real challenge. I came from Colorado actually, or spent a good amount of time in Colorado, and Giardia is endemic there, so it's a real challenge for us there as well. So there a couple of just big takeaways, and then I encourage you also to email me and we can discuss this further. Giardia is tough because it's fecal to oral passed, and so an animal could potentially continue to infect itself. And so in order to control Giardia, we need appropriate anti-parasite control, which there are any number of products that we can do that for effectively for Giardia. But the bigger issue is controlling any potential for reinfection. So our disinfection is super important, particularly the cleaning stage of what we discussed today. So removing that organic material is going to be very important for Giardia, as well as removing and cleaning any soiled laundry or anything that the animal could reinfect themselves with. But please reach out to me and we can talk in detail if you need more help.
And then last question, is it recommended to use a product like Wishy Wash a couple days a week or daily, and then a deep cleaning sanitation or deep cleaning or sanitation once a week?
And so I will assume from this question, you mean maybe two different products is what I'm assuming. And yeah, there are real benefits to that. If you have, like, say, your day-to-day cleaner, and then maybe you take a more thorough protocol for when maybe the kennel becomes empty and you're using a different product at an increased kind of deep cleaning mode. We also see this occur very effectively at some of our organizations who have just a mandated deep clean day. You know, maybe it's every Tuesday is deep cleaning day, and that's the day that we're using, you know, our products that are appropriate dilutions, but those that maybe we wouldn't normally use, but as a catch-all to make sure that we're definitely controlling for our other potential pathogens. So I do think there is some merit to that. The way I would finally address that question to kind of wrap everything up, I think that is an effective measure, but it's also just thinking about this and having a thoughtful process and protocol in place in order to utilize that. So if you have the resources to do that, that's awesome. Maybe you don't have the resources to do that, but if you think about your protocol and what works for you based on these pathogens and these products, you can find something that works for you, and being thoughtful about that and having that down on paper so that everyone who's doing this is on the same page.
Sorry, one more question.
Yeah, sure, no problem.
Any recommendations for decontamination of grassy areas around the shelter after known parvovirus?
Unfortunately, there's not much we can do for that, which is why we have challenges with our puppies, and our recommendations are such, that they're not going to those, grassy areas or dog parks where they're so naive, and that can be a real challenge for us. There's no solid recommendations. And like you saw, that's the Thanos of our pathogens. So that could potentially be around for quite some time. So if you know that that's been out there, being very mindful of that and making sure that that area is not utilized, especially by naive animals like puppies, is going to be very important for disease control.
Well, thank you so much, Dr. Orchard, for coming and sharing your time and your expertise. We will have another webinar next month. And so thanks for attending. Good afternoon.